All right. Hey guys, this is the second video. It's going to be a little bit more in depth about what I do as a counselor and what my day-to-day looks like. So I have some notes, so if you see me glancing down, it's just so I remember the different topics I'm supposed to cover here. So the other video showed you a little bit of what a day in my life looks like as a counselor during COVID. So let's just start with what is a counselor. So I'm a counselor. A mental health therapist is another term for it. Basically, what I do is work with people to support and grow their emotional health. So counselors can work in lots of different settings. I work in individual counseling, which is one-on-one for 50 minutes to an hour appointments per week. Counselors can also work with couples, families, kids. They can also work in residential settings. So this would be like a hospital setting or a long-term treatment program. So some common examples like that are Creekside in Kingsport. That is an inpatient setting where counselors can work. We don't really have any residential treatment centers around here, but think of when someone says they're going to a residential treatment for an eating disorder and they live in a place and get the help, the 24-hour support that they really need. That's sort of another way that counselors can work. Or they can be group therapists. So that would be that they primarily work on it in a group of people for a topic. So around here, we have a lot of what's called intensive outpatient programs, which are group therapy programs where the counselor's in a room with usually 8 to 12, try to keep it around 12 max. Sometimes it'll go a little over 8 to 12 clients, a counselor, and usually a co-counselor. And they teach skills for emotional regulation, boundaries, communication skills, helping with addictions, so teaching like sobriety skills, coping skills, all those. Think of like an AA program, but with professional focus on emotional health and well-being. That's sort of what group therapy is like. So I work in private practice at a nonprofit community mental health center. So what that means is that I see 20 to 25 clients per week, and I will see them for 50 minutes to an hour. So what this does mean is my schedule is pretty flexible. So I get to set my hours, and pretty much if you're seeing 20 clients, you're going to probably be working 20 hours in a non-client way. So for every session I prep, and after every session I write a note. Sometimes there's some extra paperwork for, like, say we need to consult with a doctor. That's pretty common that we have releases to work with the medical doctors because a holistic team approach often is really helpful for clients. With some of my high schoolers or middle schoolers, sometimes we have consults with the school counselors or with teachers if it's a specific to in-school problem. So a good example of that is some people really have anxiety about public speaking. And so you'll come to my office and we'll work through that anxiety, work on some coping skills, and we may also consult with the teacher to help get the allowances and things that will help make the student feel safe as they begin to lean into their fear of public speaking. So I work Monday, Tuesday, Thursday, and Friday, and then another big part of being a counselor, or really anyone in healthcare, and I would say this for almost any job but especially if you are one that's kind of sharing space emotionally with other people and kind of hearing their burdens, that you got to focus on self-care. Self-care is so important. And even I'm thinking like it's a little weird because I'm sitting in my closet office and I'm imagining you guys sitting in your classroom or over a Zoom call. But each and every one of you, it's really important for you guys to take care of yourself. There is so much stress and pressure on high schoolers right now. You guys are going through COVID, you're going through grief, your whole world has sort of shifted. And that's in addition to just the normal pressures and stress of being a teenager. And so self-care is so important. So what I do is I have Wednesdays where I don't see any clients, and that allows me to schedule in self-care. Take that day when I have to like go to the dentist. I use Wednesdays. I use that as a day to catch up on things. If I am behind on paperwork, usually I'm behind on paperwork is the main thing I do on Wednesdays. Sometimes I'll have a supervision meeting or a talk talking to my supervisor about something. So I don't see clients on Wednesdays to give myself the space. So if I'm having a really hard week, say I have a lot of clients that are having a really hard time, sometimes I'll just take Wednesdays and not do any work, and go for a hike, sleep a little extra, take a nap, spend time with people I love, make good food, a lot of those self-care things that just allow me to be emotionally balanced and able to be fully present for my clients. Okay, now you know like a big overview of what counseling is. And I bet you're wondering like, what specifically does a counselor do? Like, what does an actual session look like? I wish I could show you guys, but with confidentiality, I can't show you a real session. If I were able to be in person, what we would do is sort of role play a session, and I might have one of you guys be a client, and I'd be the therapist to you, and we sort of role play what it would be like. Or sometimes I've done this where if I go with a coworker or come with a friend, we'll have planned out a scenario, so that you guys can really see what happens during a session, because there's so much fear and stigma over just getting mental health help around here. I'm really impressed by your generation, and you guys seem to be way more open to mental health and mental health support. But even so, there's still a lot of stigma around seeking help, that if you go to counseling, it's seen as some sort of weakness or some sort of failure. I'm just going to tell you it's not. It's not. Mental health is just like any other health condition. We need to be treating our mental health just like we treat our physical health. And so it is not a weakness to go to therapy. I acknowledge that there's stigma around it, and I work every day to sort of tear down that stigma. So what actually happens in a therapy session can help, like knowing what happens helps tear down that stigma a little bit. So let's see. Since I can't role play it, here's what we'll do. We'll just imagine a client. We'll do someone that you guys can really relate to. Imagine I'm the counselor, obviously, and I have a high school, let's say a junior in high school, or a senior. Let's say a senior in high school coming to me because they have anxiety about their future and college process, and their parents are worried about them. They're not sleeping. They feel they're very stressed. They're kind of irritable with their friends. Maybe they're having little outbursts of like, just can't handle everything. Bet some of you might feel like that. So in my office, if for an initial session, they would come in, we would spend most of the first session just getting to know each other, maybe not even talking a lot about the problem, unless the client, so say this high school, we'll say she's a girl who's struggling with anxiety, wanted to talk about that. We would spend the first session getting to know each other. I would share about me as a therapist. I'm very honest in sessions. I'm going to tell you fairly bluntly, hey, this is what I think, or like, you're ignoring this feeling. I'm going to tell you that I practice what's called narrative therapy for the most part, because I believe that our stories are where we find meaning, and that we live in stories. And so we also have the opportunity to re-story things, to change our stories, to change our perspectives. And so I work from that approach, and we talk through a lot of stories. We share stories. We look at other people's stories. We dig really into the client's story to figure out, where are those stops? Where are the pieces that you've like owned as your identity that maybe aren't really a part of you, but we can externalize them? And so we'll spend a lot of the first session talking about what the client likes to do, what they find stressful, what their hobbies are, what are their relationships with their friends like, their family, just like you would kind of get to know a friend. But there are some specific areas that I'm going to tend to focus on when I'm in an initial session, because it helps me know I'm also not only getting to know them as a person, but I'm getting to know them as a therapist. So I need to be continuously assessing for where are they at mental health wise. How is her anxiety impairing her life right now? How is this anxiety affecting her emotional state, her relationships, her schoolwork? I'm looking for those as we build the rapport and relationship between us. The most important piece of therapy is the relationship between the client and the counselor. That relationship is what creates change. So after we talk through, get to know each other, we built some rapport, we're going to set some goals. So for her, we would probably set goals of reducing her anxiety. That would probably be our main goal, honestly. Reducing anxiety and helping her sleep, helping her find some coping skills to help with anxiety, and probably creating some sort of self-care routine in her week. So, man, I wish I had another person here. I don't even think I could make my dog be our pretend client. It probably wouldn't be helpful. But so we're going to work on, we'll talk through, so our next session, say we're on the second session and we're working on the goal to increase coping skills. So what we're going to do is we're going to talk through, okay, tell me about how was this week? Where were you feeling a lot of anxiety? And the client says they're feeling a lot of anxiety because they're unsure of what they do with their future. And so we'll take time to explore that story. What do they love to do? What are their passions? How does that fit in the world? We might do a career test to see, we have a lot of career assessments, career tests. Probably your school has them available for you to take if you ask your school counselors. And those can help sort of inform where you might fit well in the world. They're not end-all be-alls. If a career test says you should be a boxer, but you really love cooking, okay, go after cooking because that's what you really love. That's what you're passionate about. So we might do one of those, but we're going to talk through where does she feel this immense pressure? What is really the root of the anxiety over her future? And then we'll also probably work on some mindfulness skills. So I'll teach her some deep breathing. We might do a creative arts approach, but we're really going to dig into, tell me about the stress, tell me about the anxiety, tell me about how it affects you, and let's work together to come up with ways to help you manage it better. So that she might be working with me for a couple weeks. She might be working with me long term. It sort of depends on where the stress is rooted. If it's a really recent, rather simple, what we would call a simple root, it might only take 3 or 4 weeks. If this has been her whole life, because one of the stories she tells herself is that if she's not perfect, she's not worthy. That might take a little longer to sort of undo, to sort of get to the root, to restory, and that's okay. People can be in counseling as long as they need to. So that's sort of what a session might look like. Other problems that I commonly will treat in counseling. So I really like focusing. So every therapist doesn't work well with everyone, right? We're all different. We all have different personalities. And like I said, the fit is really important. But also the competence and expertise in certain areas is really important. So I really enjoy working with people that have experienced trauma. People I work well with self-harm, suicide, either ideation or intention. I am working with eating disorders, and I really love working with athletes. That's like one of my main passions, is working with athletes and the unique circumstances they face due to their mental health, and sort of lack of support in some of those areas. So one of my coworkers really does all couples. I'm not a huge fan of couples therapy because it doesn't really fit me as a therapist. But she is really good at couples, so she works through divorce, communication difficulties, infidelity. And then I have another coworker who specializes in kids. He is getting his PCIT certification, which is parent-child interaction therapy, which is a therapy that teaches parents how to interact with their children in ways that rewards good behavior, basically. And so it improves behavior issues in the child. And these are children ages 2 to 7. Outside that range, you're not eligible for PCIT, but we may teach you the same skills. And so he does a lot of therapy for kids. So his main focus is kids play therapy. Kids talk to us through their play. Kids tell us what they're feeling through their behavior. And so he does a lot working on behavior, working on play, having kids play out scenarios, process their emotions that way. So you can really focus on any piece of emotional health as a counselor. You kind of find your niche and you get into it. Yeah, so there's a wide range of not only settings you could work in as a counselor, but issues or presenting concerns that you can work with. So let's see what training looks like to become a counselor. So you need an undergrad degree. It can be pretty much anything. It's recommended that it's in psychology. I actually have an undergrad degree in engineering, in industrial engineering, and I still became a counselor. You just need an undergrad degree. And then you'll need a grad school degree. You'll need a master's in counseling, and then you'll work toward licensure. So each state has a different licensure processing or licensure process. Some of them are fairly similar, some are really different. So in your grad program, you'll do an internship. Your grad program will be 60 hours. So that takes about 2 years if you're taking 15 per semester. And so you'll do an internship and you'll do a practicum. Your practicum is 100 hours of seeing clients where you're mostly observing. And then your internship is 600 hours of seeing clients where you're actually being a counselor. And so that will be done in the context of grad school, and that's really important for licensure. So in Tennessee, to get your license, you have to have a master's degree, 600 hours of internship, 100 hours of practicum. You have to take the NCE, which is the National Counseling Exam, the NCMHCE, which is the one I'm taking this week, which is the National Clinical Mental Health Counselor Exam. And you also have to take the jurisprudence exam. Jurisprudence is an ethical exam. We have a code of ethics for our profession, and that exam just tests that you know it. In addition to that, you have to have worked two years in the field with a supervisor. So that's what I'm doing right now. I'm actively under supervision. So that means I have liability insurance, but my supervisor also has liability insurance. So at the end of the day, she is liable for me. If I make a mistake, she is liable. And so there's surrounding rules around how that looks. So you have to have an active supervisor. You have to have at least 1 hour of supervision every week. And there's like a total number of supervision hours you need to finish the licensure process. And then you need 3,000 hours, 1,500 of which need to be direct client contact hours. So I am almost at my hours, haven't quite gotten to the 2-year mark yet. And then I've taken one of the 3 exams. So if all goes well, I will be licensed next August. So August of 2021, that will be my 2-year mark. And once you get licensed, you no longer have to be under active supervision. You can file insurance. You can do a private practice. You can do teletherapy. Pretty much having a license opens the arenas that you can work in. You also tend to get paid more once you have a license because you're more qualified, one, but you're also liable for yourself versus your company or your supervisor being liable for you. So if you want to become a counselor, that's sort of what you do. You got to do undergrad, you got to do grad school, and then you got to go through a licensure process. And so that is sort of a good overview of what counseling is. The last thing I'll really talk about is how COVID has affected this. So like you saw in my day in a life video, I am doing all teletherapy right now. Before COVID, I was doing all in-person therapy in the office. And the office I work in is, I'm at Covenant Counseling Center, and we work, what's the street? It's downtown Kingsport, right off of Church Circle. And I had pictures of my office, but unfortunately, my phone died, so I don't have those pictures anymore. If I did, I would show you. But basically, our offices, they look like little tiny living rooms. They have comfy chairs in them. They're fairly small, but they're really cozy, and we sit in them. And so I'm sitting on one chair, and the client's either on the couch or on the other chair. Sometimes we pull out the little table, and we'll do an arts and crafts. But before COVID, I was seeing all in-person therapy. Because of COVID and because of higher risk, and our offices don't allow for social distancing, especially in our lobby. And then some of our offices, you actually can't sit 6 feet apart. because of how small they are. We are right now doing mostly teletherapy. We do have a few counselors that are seeing some clients in person, and we're working towards kind of shifting back to in person as best we can. But we have to figure out how to adhere to the guidelines, social distancing guidelines, the recommendations by the CDC. And so we're working really hard to figure that out. But what I've decided to do, and what me and my supervisor have talked about, is I'm going to stay all teletherapy for as long as I can. I do have some health conditions that put me at higher risk. And so this is not only for my safety, but it's for the safety of all my clients. And what's interesting is I also have clients that are at high risk, and their doctors have told them don't go out in public. And so this allows a lot of access that maybe wouldn't have already been there. So that's a pretty big shift for me to go from all in-person counseling to, in March, the one day, like, okay, I guess I'm not going back to the office. I'm going to do all teletherapy. But it's been a pretty good shift. There are differences to teletherapy for sure. There's a little less, it requires more effort sometimes on the client's part to make sure that they have a focused, quiet, they're not going to have any distraction space, which can be kind of hard for some clients. Think about if I have a client that has 4 small children, it's hard for them to like go sit somewhere and not get interrupted. But in the same time, they would have arranged for care for the kids to come to the office. And so this way, they're arranging for the care might need to be smaller. I've had other clients that I've seen so I have some clients that have chronic illness, and so sometimes they're in the hospital. And obviously, if they're in the hospital, I can't see them in my office. And this has allowed me to continue to see them even when they're in the hospital or just can't get to the office for some reason. So that's been a pretty big shift. It's gone pretty well. There's a little bit of an energy difference. You guys probably feel this with Zoom classes. There's a different energy when you're in class, able to read off people's body language, than when you're sitting on a Zoom call and reading off of people's body language on a Zoom call. It's just different. But I think it's helpful in some ways because it requires both me as a therapist and the client to really lean into how do we best communicate what we need? How do we best communicate what we feel? I think it's also a positive in that it's just more flexible for scheduling. And so I'm getting to see clients more often that couldn't get to the office because of work, because of scheduling, and because they're able to do it from anywhere. It's much easier and they're more flexible in getting scheduled. And my schedule's a little bit more flexible too, because I don't have to be at the office. I can be at home. I could do a 1-hour appointment in a nighttime if someone needed it. Whereas if I was still in the office, I wouldn't want to drive back to the office just for one client and drive home. So that's a little bit about counseling. I love advocating for mental health. I love talking about mental health and talking about counseling. I sometimes will give presentations to sports teams or dance studios about different mental health topics. I've done suicide prevention trainings. Getting it out there, having real conversations, and giving space for these hard questions like, what does it mean to be depressed? How do I support myself? How do I support a friend who is struggling with an eating disorder, struggling with anxiety? What do I do if someone tells me that they're wanting to hurt themselves? Like, I want to be there for those conversations, because the more conversations we have, the healthier we're going to be as a society. And also that I know the pressure and the pain and all the feelings in any of those situations, and that it wears on us to either be the person that's feeling like that or be the person trying to support that person. And so any one of you is welcome. I will always welcome it to reach out if you have any questions or concerns. Or just have like anything like, hey, what about this? What about this topic? Could you give me some more information about that? So I will make sure that I'll probably just have Kasia, I'll just give her my email, and so she can send it to the class. It's kind of long because I have a really long name. So I'll just write it down and send it to you. And then I'll also give you my work number, so you can always call that number or email me. And I would love to connect with some of you guys if you have further questions, or really you have needs about your mental health and want to get connected to a counselor, for yourself or for a friend. I can help give you some referrals or help talk to your parents about what that would look like. Or if you want a suicide prevention training, something like that, I am available and able to do those things also. So I hope you learned a little bit about what a mental health therapist does today. And I'm going to sign off now. I'm going to go back to, I have another client in about 5 minutes. So I will upload this to YouTube and get it over to your class. All right. Thanks, guys. Bye.